The different causes of constipation in babies. Constipation is one of the main sources of discomfort in babies and a big concern of parents. In order to avoid it, you need to know the origin and the first symptoms. Is your baby angry, crying, and you don't know what's wrong? Maybe he's constipated. In this article, we tell you what are the main causes of constipation in babies and how you can relieve your little one's discomfort. Don't miss out on these great tips. What is constipation in babies? Constipation is a common problem in babies and children. In fact, it is one of the reasons that most often lead parents to consult their pediatrician. It should be noted that between 0.3 and 8% of the child population suffers from it. There is no clear definition of constipation in babies, although as a general rule, a baby is considered constipated when the amount of common daily bowel movements decreases. There are children who defecate 4/5 times a day and others do it once a day or even every 2 or 3 days. The baby has trouble evacuating because the stools are hard. The child suffers while relieving himself. The consistency of the stool varies. In general, there is a ball-shaped feces. Of gas and cramps occur. Causes of constipation in babies. Before getting to the heart of the matter, that is, talking about the causes of constipation in infants, it is important to note that generally breastfed babies rarely suffer from this problem. In fact, they often defecate several times a day, even after each meal. Their stools are usually watery, or very soft, yellowish-orange in color. 1. Formula milk. Some children are likely to develop constipation in response to the proteins in powdered milk. According to a study published by the Journal of Pediatricians, switching from breast milk to formula can also generate this discomfort. It is possible to find formula milk on the market indicated for mild constipation. Consult with your pediatrician to choose the milk that best suits your child's needs. 2. Complementary feeding. Another cause of constipation in babies is the switch from exclusive breastfeeding to complementary feeding. Including new foods in the baby's diet can lead to constipation, although it is true that during the first few months, babies usually do not consume large amounts of solid foods. Remember that the first foods to include in your baby's diet are vegetables and fruit. Follow your pediatrician's recommendations to avoid discomfort such as constipation or complications such as food allergies. 3. Diapers. Some children may experience constipation when they are no longer diapers. The use of the pot generates stress and even rejection in some. They can cause constipation by refraining from defecating because they do not want to potty. 4. Dehydration. When complementary feeding begins to set in, we offer water to the little one. Some children are not inclined to drink water at first, and when milk intake is reduced, especially in the summer, then they could easily become dehydrated. If the baby does not drink enough fluid, the stools may become hard and difficulty in passing it. Along with small wounds in the anus, you will see traces of blood when cleaning. 5. Medical problems. Now let's look at the more serious causes of constipation in babies. Botulism. This disease is caused by the bacteria Clostridium botulinum and is potentially fatal. One of its symptoms is precisely constipation. Congenital hypothyroidism. The baby does not have a thyroid gland, it is not functioning well, or it is not sufficiently developed. Metabolic disorders. Some inherited diseases associated with one type of immobility can be an indirect cause of constipation. Food allergies. An allergy is an exaggerated response of the body to what it considers to be aggression. Symptoms can range from hard stools to diarrhea, to difficulty evacuating. Hirschsprung disease or congenital megacolon. It is a disease that affects the large intestine and prevents the possibility of emptying the intestines. 4 tips for relieving constipation in babies. If your child is very upset, in pain, or if you are very worried about him, do not hesitate and make an appointment with the pediatrician. Better than anyone, he can give you the necessary recommendations to relieve your child. Here are some tips that you can put into practice preventively or as a solution to constipation. 1. Massages. Massages in the baby's intestines help improve intestinal transit. Make circular movements with the palms of your hands on the baby's tummy, gently but firmly, exerting slight pressure. 2. The exercise. If your baby can crawl already, let her. All types of movements and games will help improve intestinal transit. You can even help him by moving his legs up and down as if you were riding a bicycle. 3. Vegetables, fruits, and fibers. If you've started complementary feeding, add vegetables, fruits, and fiber to your child's diet while reducing foods that can generate dry fecal matter, such as bananas or rice. 4. Liquids. Make sure your child drinks enough milk and water. Remember that otherwise, the stool may harden, making it not only difficult to pass but also painful. The causes of constipation in babies vary widely, and it can sometimes be difficult to spot the right trigger. Do not hesitate to consult your doctor for the appropriate diagnosis and the best treatment for your child.